The best treatment for a torn meniscus is prolotherapy. The meniscus is one of the cushions of the knee. Using the knee model, we can see here on the femur is the articular cartilage, and this area here is the meniscus. There's a medial meniscus and then a lateral meniscus. All anyone has to do is search on the internet, and you know that the typical treatment, even of meniscal tears, is the surgeon's going to remove it. So you need your meniscus to cushion the knee. Once you have the meniscus is taken out, and normally it's a partial meniscectomy, then the pressure on the articular cartilage goes up dramatically. So if you want to get aggressive arthritis in the future, then get arthroscopy and have the meniscus taken out. A much better treatment option is to leave the meniscus in, monitor your exercise regime, and get prolotherapy. So prolotherapy to the inside of the knee where the meniscus tear is by far the best treatment option. Now, sometimes we have to use kind of fancy solutions. You might have to use human growth hormone in the prolotherapy solution. You might have to use platelet-rich plasma, or sometimes we even have to use bone marrow. So I've had sometimes to use bone marrow because there's stem cells in the bone marrow that can differentiate into fibrocartilage cells. Fibrocartilage cells, or fibrochondrocytes as they're called, are actually what are the cells that make the meniscus. The meniscus has a poor blood supply, so that's why surgeons typically take the meniscus out. They normally don't repair it, they take it out. So a better treatment option would be to enhance the healing effect of the meniscus by prolotherapy, by injecting solutions where the meniscus is torn. It'll stimulate the immune system to come to the area, accelerate the healing process, and heal the meniscus. How do we know that the meniscus is healed? Well, you typically know because you can get back to all your activities. The only guidelines that you need to know after prolotherapy is don't do anything that causes clicking in the joint. Don't do anything that causes sharp pain where the meniscal tear is. And then if you have more knee pain after exercise, it's just got to go away within 2 hours, otherwise you did too much. But typically after 3 to 6 visits of prolotherapy, done every 4 to 6 weeks, the person's back to all their activities. So, and I really encourage folks to go to www.prolotherapy.org or www.prolotherapyresearch.com, because I wrote with my staff, we've written 2 really good papers on MRI documented meniscal tears and degeneration that have been treated with prolotherapy. It's very, very successful.